Okay. Hello, and thank you for joining us for tonight's final webinar of this year's Service Month. In this session, you'll hear from dentists who have made a huge impact in their communities by volunteering their time and expertise. We're very excited to learn more about growing in service. I would like to start with introducing myself. My name is Gabriela Hunter Rodriguez, and I'm currently the COPE chair. And then if my associates would please introduce themselves.
Hi, I'm Shivani Iyer. I'm a D4 at Penn, and I'm a COPE associate.
And hi, I'm Dominique. I'm a D3 at Tufts, and I'm the Kofi Associate too.
I'm a D4 at LECOM. And I'd also like to introduce our lovely Sarah. She is our ASDA staff liaison, and she helps keep us together.
Hi, everyone.
So we are so excited to welcome our panelists for this evening. We'll start with Dr. Martha Ferreira, who is an assistant professor at Tufts University School of Dental Medicine in the Department of Public Health and Community Service. She is the director of the school-based dental clinic and a co-director of the Pediatric Community Service Learning Rotation. Next, we have Dr. Albert Tom, who is a health sciences assistant clinical professor, group practice director, and Axiom coordinator at the UCLA School of Dentistry. He has extensive experience in academia, in the private sector, and as a practicing dentist, as well as vast volunteer experience in local and global communities. And lastly, we have Dr. James Morrish, who is a board-certified orthodontist who currently precepts at the LECOM School of Dental Medicine. He balances private practice, a life in academia, and takes part in an interdisciplinary team as the team orthodontist for the Johns Hopkins All Children's Hospital Craniofacial and Cleft Palate team at their Tampa outpatient clinic. Before we begin, I'd like to share a couple of housekeeping items. First, this session will be recorded and available to ASDA members through our website. I would love if you guys would turn on your cameras if possible and participate. We will take questions for the panelists throughout the webinar. Questions can be submitted at any time through the chat on the bottom or right-handed side of the screen, or by raising your virtual hand through Zoom. Now, let's learn a little bit more about our panelists. So if Dr. Martha Ferrer would begin.
Hello, how are you? First of all, I want to thank, the group that offered me the opportunity to be part of this webinar and that allow me to talk about something that is very close to my heart and is, be able to work clinically, but also to practice, in public health settings. So I'm gonna tell you a little bit about myself. I'm from Bogota, Colombia, and I received my DDS in one of the universities in Colombia. And later on, I got my master in pediatric dentistry at University of Michigan. Believe it or not, also I had my dental hygiene degree. And so I think I have explored everything and anything because I think that opened different paths in life. Uh, Actually, I am doing like I said, a public health and communities, a public health program with dental emphasis at AT Still University. And my love for public health started very, very early on. When we finish usually in Colombia our clinical training, in order to obtain your dental license, you need to do a mandatory 1 year service at a low access to care, region. It could be, in a big city, it could be in Amazon, but it's a mandatory. So we were discussing before you start the panel that this is something that teach you start giving very early in your professional life. Like we mentioned at the beginning, I am the director of the school-based program at Tufts University. So that is a very unique experience that we offer to the third-year dental students. And it is a clinic that we have in one of the elementary schools. It's really walking the distance from Tufts. And at this school-based program, what we do is we provide oral health education clinical services that include, of course, prophy's, fluoride treatment, sealants, to about 300 children. We do it per year. At least 3 of the kids in the school register for the program, and they are going from kindergarten to 5th graders. And so I think school-based programs really enhance children's well-being and contribute to broader the public health goals. And all this is, by improving the access to care. In the present, I'm doing a little bit of everything. And so I keep very involved with Tufts Community Grant Board. So I'm a committee member. And what we do yearly is to, we receive at least like I would say 100 grant application for different programs, and they are not only dental programs. We have a very interprofessional team, so we give lots of grants to programs that they work in nutrition, work with the sports, work with public health, and with mental health. Also, of course, I speak Spanish, so I'm very involved with Massachusetts Hispanic Dental Association as well, with the Hispanic Dental Association, that is the national organization. But I think one thing I'm going to mention, and then maybe we're going to talk a little bit more. At Tufts, we created a program called Autism Smile, and we serve, families that have children that diagnosed with ASD, and we provide a sensory toolkit for them. And so we really work on kind of decrease the barriers that population has. I'm gonna let the rest of the panelists to enlighten us with their background and what they're doing.
Thank you so much, Dr. Ferrero. We really appreciate your time. Next, if we can have Dr. Albert Tom speak.
Hello, everyone. And first of all, I wanted to thank the presentation people, Gabriella, Shivani, and Dominique, and especially Ms. Sarah Murphy for putting this on. I'm happy to be among one of the panelists with my esteemed guests, Martha and James. I'll tell you a little bit about myself. I've been teaching here at UCLA for 37 years. And I started out right after I finished my general practice residency. While I've been here, I've been teaching. I started teaching 1 day a week while holding a private practice. And during this period of time, I've always been interested in community service. So I was volunteering like once a month for a community clinic. And then I recently transitioned my practice to my daughter, who is a 2019 graduate of the University of California, San Francisco. So she's taken over that practice, and that's given me a little bit more time to spend at school. I am full-time here at UCLA, and because of that, I've been able to look into and be introspective as to what I believe my career path has gotten me, and what it is that I want out of life, and what it is that I want to impart upon this new generation. And that's the spirit of giving and the spirit of being altruistic and volunteerism. Because of that, I am a group practice director. I'm engaged with many students here. I have 75 students under my care, starting from D2, D3, and D4s. I help them meet their graduation requirements, and at the same time, I want to impart upon them the value of giving back to community, which I must admit is not a high priority at our school. And because of that, I've taken the reign to decide that I wanted to be the outreach coordinator of this university, and I've done that. And in fact, I applied for a grant that was campus-wide. It was open to campus-wide. And I was successful in getting one of the 10 grants for curriculum development. And my goal is to introduce volunteerism and altruistic dentistry into the curriculum, which we have never had before. I am also the mentor for one of my D2 students. She's in a health equity challenge contest that was open campus-wide to all the disciplines, medicine, nursing, physical therapy, public health, And she actually made it to the finals. So we're one of the finalists, and we're hoping to get one of the 4 grand prizes, which would be $50,000. With this $50,000, we hope to expand our outreach in terms of having a mobile dental clinic. Now, it's only going to be able to get us so far, so we're still in the preliminary stages of working out our proposal. We are going to be meeting with community partners in order to try to get this program supported by the community partner by way of a benefactor. And then, like I say, the benefactor will be donating $50,000. So we'll be donating 4 prizes of $50,000 or $200,000, which is quite a bit of money, and to be used for volunteer basis as well. So I'm very, very excited about that. I'm very excited about where my life goals have turned into. And it has been less than making money and more about helping others. And I tell you, I'm very happy to be here tonight in the presence of all of you who share a common goal, and that is to help others. And I seem to be most comfortable when I'm around people like you. It just seems to make me even more motivated. And I hope to impart some of that motivation as well to some of you young people. If we can impart this ability to volunteer, the passion to volunteer in future generations, I think that our world will be in a better place. And we know it's pretty messed up right now. So that being said, again, projects such as the Health Equity Challenge that was sponsored by this benefactor to ask people who might be interested in helping the community. That's one way in which I think that we can help target younger population. We can ask them to become involved in what is considered in the beginning to be an academic project and a financial award project, but then in having met some of these applicants, I'm finding out that they're truly passionate about these things. So it's not just about money, and it's not just about academics and winning this award. It's about being passionate. So I'm very pleased to be able to impart whatever knowledge that I can tonight through this panel discussion. Thank you.
Thank you so much again, Dr. Tom. And then lastly, Dr. James Moorish.
Well, hello, everyone. Again, I am very honored and humbled to be a part of this, wonderful group tonight. It's just great, and I think the topic is so important. And it always has been, but it's even becoming more important. A little bit about me. I practiced orthodontics for 41 years, private practice, but at the same time, I was involved with academics. I was a clinical professor, adjunct clinical professor at Nova Southeastern for approximately 10 years. And for the last 13, I've done the same thing at University of Florida. A couple years ago, I sold my practice, and I knew I just couldn't sit there and do nothing. My wife wouldn't let me be in the house anyways. But so I am now at LECOM Dental School, School of Dental Medicine, full-time. I am the director of postgrad orthodontics, but also I'm also the preceptor for 105 third-year dental students. One of the programs that we've started is because I've been involved with cleft palates for quite some time. And so I am on the cleft palate team at All Children's Hospital, Johns Hopkins All Children's Hospital. And so what our dean and came up with, along with myself, is what we wanted to do is to provide our D3 students with a outstanding clinical experience. So they get to have they are allowed, and they can sign up, it's volunteer, but they get to go to the outpatient clinic and do a rotation. The clinic is not, we're not treating children there. We are, it's more of a diagnostic and evaluation situation, but it's a multidisciplinary team with plastic surgeon, pediatric dentist, pediatrician, audiologist, speech pathologist, psychologist, a facilitator to help the families find assistance, and then the orthodontist. And so we get to interview, and the students get to see firsthand these cleft palate kids, also craniofacial kids, and they can see that the non-syndromic kids are normal kids. And in Florida especially, and I'm sure a lot of different states, getting treatment for cleft kids, because most of them are on Medicaid, is challenging at best, especially in the orthodontic arena. So what we want to do, especially those who are just going to not just be general dentists, because general dentists are amazing and they're very, very important. But most time they think, oh, only the people who are interested in going in orthodontics or pediatric dentists or surgery are going to go. No, we want the people who are just going to be the general practitioners, because what we want them to see, and this is what they do get to see, is that you can treat cleft kids, craniofacial kids, just like everybody else. There's no reason you cannot. If you are treating children in your practice, you can treat these kids. So we are trying to increase the access to care for these children, which they need. And I'll tell you, I find that most of these cleft kids are, they're smarter than most. They're great, okay? They're wonderful and they're easy to work with. So this is what we're trying to do. And the other thing, what we've done is, because again, in Florida, getting orthodontic care for Medicaid kids is next to impossible. We are now treating the cleft palate kids at LECOM. So I have third-year dental students and orthodontic interns who are helping me. So again, the experience that these third-year dental students are getting is just fantastic, because they are there, they're hands-on, and they're seeing it. So what you see, you can believe.
Thank you so much, Dr. Morris. You should consider bringing it to the fourth-year dental students. Just a thought. But I'm going to have our lovely associates give you guys some questions. So feel free to answer as you please.
Alrighty, so the first question for our panelist is, what inspired you to get involved in community service as a dentist?
So I'll start off, and I'll be honest, it was probably for selfish reasons. I was trying to fill my week in private practice, and I just wasn't busy enough. So I decided, well, I was going to volunteer my time at the local community clinic just to fill the week. Well, what became a selfish cause turned out to be passionate, and I decided that really it wasn't the money, it was helping others that really mattered. So I appreciated the fact that I had this opportunity, and I was introduced to it by volunteering one day a week at a community clinic, and I saw that there was a need. And I found that at the end of the day, even though I was exhausted and I did all this work, and I thought, well, if I were in my practice and I did all this work, how much money would I be making? It wasn't important how much I made. It was the fact that I was able to put a smile on somebody's face. And that's what started all of it for me.
For me, I think it's something similar, because was the desire to make a difference and make a difference for underserved populations. So like I mentioned, after I finished dental school, I ended up working in a hospital where there were, children with the barriers they had, those families, they were amazing. And so we were able to treat patients every half an hour, and believe it or not, the value of the appointment was like equivalent to $1. But to see, giving back those smiles, eliminate that pain, and work a little bit on what, we are so familiar, the social determinants of health, that show us all those barriers that the patient have, because to treat a patient clinically is a lot of technique, but to get to know what prevent this patient to get the service that they need is something that truly inspire me, and it became like an addiction. Every time somebody said volunteer, I would jump into those opportunities. And so I did it, like I said, in Colombia. The doors were open here. to do it here. And when I moved to Turkey, it was the same. So right now, even, you know, if I have a program, I always gonna try to kind of talk to someone so they can implement it anywhere in the world. They can do it.
Okay, so well, what got me involved is two basic things. One is my faith. Number two was my father. My father was a cardiologist here in Bradenton, and was very, again, for us, it's very old school, but he did a lot for the community, did a lot for underserved areas, people who, you know, were financially challenged. But he did so much. But guess what? He never took credit. It was always, you know, behind the scenes. Unfortunately, now we see a lot of people who want to give money and do things, but guess what? They want their names up in lights, okay? They want to be recognized. You don't do it for that reason. You do it for what's in here, okay? It's what it gives you the feeling, okay? And once you get that feeling, guess what? It can become a drug, okay? Essentially, you go, I want to do this more, okay? Because it is. We are so fortunate in being in the dental profession. Our community gives us so much. We need to give back to it, you know? We just need to do that. So, until I got involved with clefts, basically what we did in my practice is when there's someone who came in and needed help, we discounted a lot of fees and treated people for free, okay? We have so much, we were going to do so much a year, and that's what you can do. You don't have to go out. You'll have people coming to see you. So, but that's how I got involved.
Yeah. And I have to, jump a little bit of what Dr. Morris said about collaborating with other people. And so we are so used to work intraprofessional. So I work very close with orthodontists. I work very close, with endoperio. But when you open your life to the interprofessional and you work with ABAs and you work with OTs and you work with surgeon and you work with social workers, it's amazing the role. They really appreciate that you give, that little extra time also and knowledge to make the treatment of those patients more holistic. And so, and we become educators, we become advisors. So I think that is very important.
We as dentists, we belong at the table. We are not just dentists, okay? We are much more than that. And what's so nice about when at the clinic, at the end of each session, everybody gets together and you discuss the case. And what is so great about, this type of environment is the dental students get to see how everybody is important. Everybody respects everybody else's opinion, because what you need to do, you need to listen to people who are specialists in that area. So that way that child or that patient can get the best care. That is, optimal dentistry or optimal medical care, anything else is collaborative. Everybody has to, it's just not a single thing. You've got to work together. And so that's what these third-year dental students at LECOM are getting exposed to, which I think, again, you can talk about it, but until you experience it, it's just not as real.
So thank you guys for sharing. So question number 2 is a 2-part question. The first part, I think most people have already touched on, but the first part is, what community service projects or events have you done as a dentist? And the second part is, which was your favorite and why?
Well, I've done a lot, and I know all three of us done so many. So it's hard to pick what is, your favorite. I'm passionate right now about cleft lip and palate and what you can do and how we can bring the treatment to more and more of these children who need it.
So I am the faculty facilitator advisor for the AAPHD, which is the American Academy of Public Health Dentists. And because of that, I am the outreach coordinator. And because of it, we like to get involved with as many projects as we can. So I've obligated to be doing 2 outreach projects per quarter. And typically what we do is we participate in projects based on the need. And as most of you know, we've suffered some wildfires recently here in California. And so this coming Saturday, we will be volunteering at an event in order to help those that lost their homes and or those that are in need of dental work in that area. So that's what I've been doing. I've done several local missions and a couple international global missions. And I'll tell you, what was my favorite? Well, my favorite one was last February. I took 30 students down with me to Tijuana, and we took care of the refugees from Central America that were emigrating for a better life, going from the south to the north with the idea of crossing over into the US for a better life. Some may say that this Refugee Health Alliance was very controversial, which it was, because you were basically accepting the fact that these were refugees, not legal residents, legal citizens of Mexico, crossing other countries in order to get into California for the purposes of a better life. Years ago, one of my outreach mentors told me, we all bleed red. And when he told me that, it made me decide that this was an easy decision for me to make. We are no different than anybody else. We all have needs. And for that reason, I find that the RHA event was the most impactful for me and my students. And whenever I find that I'm impressed or impacted by something that happened to me in my life, I like to write. And I happen to be writing for Angels in Medicine, which is a publication dedicated to humanitarian causes. And the editor and I have become very good friends because I've been on very many missions and I've written a lot of articles. So if you want to look up my what I've done in the past and where I've been, you can go look for that journal, Angels in Medicine, and you can look up the work that I've done. But again, I think that all missions are important. It really doesn't matter who it is or what it is that you're doing and where it is. It's the fact that you are donating your time to help others, and that's the most important thing.
And for me, yeah, I mentioned a couple of programs that belong to, entities that are organized dentistry, like the ADA, and we, give kids a smile, lesson in the lunchbox. But yes, I have to talk about Autism Smile. So everything starts because definitely I see lots of families that they are faced with the diagnosis of, autism, and for them, the fact that there is not a biomarker is extremely overwhelming for the families to get. And when you have families that, because I work in beside Tufts, I work 1 day a week, and in a community that I think on Fridays I never speak English. I only speak Spanish because the community that they have lots of immigrants, and for them culturally also is a diagnosis that it's very difficult for them to face, in their families, in their communities. So what we did, we create this program that the aim is to desensitize children with autism to the dental settings. And so not only, we invite them, like we have events in person, like once or twice a year, and we bring them and we let the family and the little ones to go and get facing all these sensory issues that we face when we go to a dental visit. But the pandemic happened, so we were like, okay, well, how are we gonna do it? So we create a virtual format. And so we get together with the family in, it's an individualized Zoom session. And we go through the diagnosis and we go how we can work to, improve the oral hygiene at home, how we kind of prepare the little ones to go to a dentist, how to find a dental home that they are willing to have appointment, that they are not half an hour, 20 minutes appointment, but the kid can go and sit and every time get better and better. So in order to improve the program, we create a sensory toolkit that we give to the families. And everything is free of charge, everything. And the value right now of the kit is $100 because we have weighted blankets, we have social stories, we have, name it, sensory toys. And so that has been the feedback. We have done like 120 kind of sessions, and to listen to the parents saying, oh my God, you cannot imagine how long I have been waiting to have the opportunity to be involved in a program like that. So we have it right now in English and in Spanish, but our goal is to help tons of families, regardless, where they live. We have some limitation, of course, because every program that you have and that you want to offer it to a community at low cost or no cost requires funding. And that is one of the barriers when you have a program, you want to grow it. So right now we have it only in Massachusetts, and hopefully it's going to become a national model.
Awesome.
But that's the reason I said we work with a lot with OTs, ABAs, and orthodontists. We work because the little ones, we want them to start early, but they're gonna grow and they're gonna have needs, all type of needs. And so if they feel comfortable, they're gonna be comfortable in any, service they require.
Thank you guys so much. Another question, which I'm personally really interested in knowing the answer to as a D4, what advice would you guys give to new dentists who want to get involved but don't know where to start?
Just start, no, seriously. Don't try to find the perfect place. Number one, if you have a passion and you know where their need is, go there. If not, go talk to your dental society, go talk to a study club, go go down to Salvation Army, go someplace and just start, and you don't have to sit there and go, don't look for something gigantic. Just start even small, okay? And you will find that, to me, I think you're going to find that positive feeling and that feedback that's going to keep you going, okay? Because like I said, we are so blessed to be dentists, okay? Help, we've got, we can do so much, it's not like a physician, you got to do all these things. You can help so easily. So just start.
Yeah, so I agree with Dr. Morish, and I would like to add as well, are you ready? When will you be ready to volunteer? And I would have to say, when you can think of others before you can think of yourself, then I think you're ready to volunteer. I also see how expensive a dental tuition is nowadays. And maybe your parents are paying for it, so maybe you're not thinking about that. But if you are stuck with this loan, it is very, very hefty. And I do understand that your priorities may be to pay back this loan. And maybe this is not quite the right time to be devoting all your time to volunteerism. But as Dr. Morris said, yes, you can start in many ways. And you can have a private practice like I did. And then I introduced pro bono work. So, like with Veterans Day or whatever, I said, okay, any veteran can come in and I'll provide free work. I had a senior dental day in which if you're over 70 years old, then I provided free care for that particular day. And you can still make money, on your other patients. And believe it or not, I believe the gesture of volunteering is a practice builder as well. it will help your practice grow exponentially because your patients will say, hey, you've got a good heart. You're helping others. And so that's why I think that I agree with James, I agree with Martha, and I love being here and I love being able to talk to all of you. And we'd like to give you just a little bit of pearls of our advice of what we think was successful for us. And again, it may not apply to you because this is a different time. A different time when you're in debt and you have different priorities. And maybe this is not the time, which is fine. But I think that eventually, when you paid off your loans, when your family is grown, when you have a chance to look back at life and see what is the importance of life and where our career has gotten us, what kind of God-given talents have we actually learned to be a dentist? And believe it or not, we do have God-given talents. They are God-given. You are taught by faculty, you know how to cut preps, but the idea of transferring it from head to hand and in your heart are the most important things. And I think that it is definitely God-given, and we can use that in many ways.
I only going to say something very brief. I think sometimes we are looking for something very specific, but there is so many places we can contribute so much. I start with Head Start. I was like, oh, they needed a dentist and I'm like, I'm there. So it seems like we are giving, but being involved, we are receiving so much. And it really brings so much happiness. And you find like, oh my God, you feel your role in life is different. So we are not dentists, we are oral health providers, and we can be part of, like we said, any team. Sometimes, you have to be realistic how much I can fit, because if you take too much, then you cannot be compliant. You're going to be that is going to cause you stress. But you start with baby steps, 1 or 2. I said Head Start has been for me something very special, early Head Start. And I found out YWCA is also one of a very unique place that they always gonna welcome, us as oral health providers.
Thank you guys so much. It is always it's just like an honor and a privilege to hear from you guys, especially coming from such different backgrounds. We sincerely appreciate it. So just wanted to have you guys to speak on a final thought, a key takeaway you would like us to all take home after tonight's session. So we can start with Dr. Ferreira.
Believe it or not, when I was little, I was like, I never ever could engage in conversation with I was so timid. And I was like, oh my God, how, I'm gonna, become someone that can make a difference. And I think that what I learned in my childhood to get part of a family that also, my parents always, they have been givers. I think that, believe it or not, is something that you have to cultivate, and you have to, kind of do especially when you're going to join the workforce and you're going to, go to your community, do a need assessment and reach out, your like a community partners that they're going to open those doors. And believe it or not, as a person, you're gonna grow and you're gonna be part of amazing, discussions like these ones. And I'm gonna go home, and I'm gonna be, oh my God. Right now, of course, I love to work with patients with cleft lip and palate. I love this global, service trips. So always, if you have the opportunity, open your mind, study. If it's not right now, the right one, maybe next year. But always keep your mind very open to opportunities.
Thank you. Next, Dr. Morris.
Yeah, it's the same theme, is that you've got a great opportunity. I'm on some admissions committees, and what we keep hearing is, I want to help. The reason I want to go into dentistry, I want to help. Yes, you can help your paying patients, but there's a lot of people out there that you can make a significant difference. Okay. And, and people say, well, it's not the right time. Well, when you really think about it, it's the same thing. People say, when's the right time to have a child? There's not a perfect time. There's never going to be a perfect time to start, volunteering. You can start small. Okay. And yes, all the students have got such significant debts, but an hour, 2 hours, even a month, just get started, please. There's so many people out there that you can truly touch, and it'll mean a lot to them. But let me tell you, what it comes back to you, it's just amazing. So please consider this.
Thank you, Dr. Morris and Dr. Tom.
So my take-home message to all of you would be true to yourselves. You know yourselves, you know your limitations, you know your capabilities, you know your dreams. It all starts with your education and your classmates and helping each other there too. You can't help people outside of the school until you can help yourself and your classmates. I think that that's a very important issue that I bring up because I know that the level of competition is so high now to get into dental school. And, I think that this is a wonderful presentation that you all are giving because you're definitely wanting to learn about giving back. And I think that that's great. But I think that the generation is very different than when we were in school. When we were in school, it was less competitive. Now things are more competitive, and it's the me generation and not the us generation. And so I think that because of this generational change, there's a little bit of change that needs to occur before you'll be able to be where we are. We've been there, we've lived it, and that's why we can do it now. 40 years ago, I don't know if I could be the person that I am right now. I really don't think, unless like Dr. Morris said, I agree, baby steps. If you take baby steps, and that's what I did. I took baby steps. I said, I'm going to volunteer at the community clinic 1 day a week. I'm not going to want to do it because I know how much money I'm going to lose. And then at the end of the day, I said, wait a second, I really love this. But it was a generation ago. It's very different now because, really the times have changed. And I think the fact that you're giving this an presentation and organizing it speaks to how I'm wrong. And I want to be wrong. I want to believe that this new generation is like my generation. I want to believe that. And perhaps there is a change, and that's why it's happening. So again, if we need to have more projects like this. We need for all of you to become more involved in your schools, to reach out to communities, to reach out to public health organizations, nonprofit organizations, the Dental Society, as Dr. Morris brought up. There are opportunities abound out there if you want to help. And it doesn't have to be in dentistry, as he said. It could be just, helping provide food for those that lost their homes, the homeless people that are out there, and then you buy them a little bit of food. It can start from there. And so again, I couldn't have been happier to have been invited to this event. I thank you from the bottom of my heart, and my heart is so much more fulfilled having known James Morris and Martha Ferrero. I hope I see you both again, and I think that we're all in the same group of people. We all have a common goal, and that's to help others. And, I couldn't ask for a better evening. Seriously. Saturday, I have to be in El Monte at 6 o'clock in the morning, and I'm going to be working till 6 o'clock at night. But I guarantee you, I'm going to feel so much more fulfilled. And I also, if you don't believe in that, I believe in karma. And I believe that when you do a good deed, it'll come back to you tenfold. I honestly believe that. So thanks again for this wonderful evening. I really appreciate it.
Thank you guys again so much to all of our panelists for sharing their time and expertise with us. genuinely, I hope that we all cross paths again one way or another, whether it's in organized dentistry or serving in our community. But you guys definitely gave us some food for thought, and it only makes me more excited to continue when I graduate to stay involved in outreach. So I hope you guys also got to take a few notes away from tonight's session. I think this is a wonderful way to close out our service month, which is growing in service, and you guys continue to grow in service. So thank you for representing dentistry so well. But thank you to everyone who joined us tonight, and I hope everyone enjoys the rest of your evening.
Thank you very much.
Thank you.
Thank you.
Thank you.
Thanks,
you.
everyone.